5, women diagnosed with breast cancer are often left with very few options when it comes to treatment. And for years, women who underwent mastectomies were left scarred. But now there is new hope for a better breast cancer surgery. KXAN's Katina McHenry tells us about it.
I was 33 years old when I was diagnosed, and to say that it was a shock is putting it lightly.
Laura Scott admits she wasn't conscientious about doing breast self-exams, so she had no idea what possessed her to do one that fateful day in May 2010. But that's when she found a lump in her breast, later diagnosed as stage 1 invasive breast cancer.
Never did I dream, particularly at this age, that I would be dealing with such a serious disease.
Because the now 35-year-old mother of 2 caught it so early, her prognosis was good. But because she was young, her chance of recurrence was high. So she wanted to have the most aggressive type of treatment, a bilateral mastectomy.
And I had no idea what I would look like afterwards. And that was incredibly scary.
But her plastic surgeon, Dr. Scott Spear, felt she was a good candidate for a newer type of procedure called a nipple-sparing mastectomy.
And we just take out the breast tissue and leave all the visible skin and nipple alone. So it's a little bit like other advances in surgery, like laparoscopic surgery.
Spear says for years, most doctors have been reluctant to perform this type of surgery in the fear that there could be some cancer hiding behind the tissue of the nipple. But new research is finding the procedure to be safe and effective. In a new study authorized by Spear, doctors looked at 162 surgeries performed since 1989. He found that there have been no cancer recurrences in the leftover breast tissue in any of those cases.
It encourages people to treat their breast cancer affirmatively, aggressively, because you can come out the other end being okay physically.
And I will never forget, coming out of surgery, and then the nurse said, "You need to look," and I didn't want to, and she said, "No, you really have to," and I did, and it was the most amazing feeling because I looked normal.
In Austin, Katina McHenry, KXAN News.
It's important to note this surgery is not for every breast cancer patient. Doctors say it's ideal for smaller-breasted women who are in good physical shape. It is not appropriate for women who have more advanced cancers or tumors.